In this particular class of pharmacology, we will discuss about chemotherapy of tuberculosis. And chemotherapy of tuberculosis is the part of your pharmacology 6th semester syllabus, and that is unit number 3. And here we will discuss about different sections of tuberculosis. We will discuss its type, we will discuss its microorganism, we will discuss its signs and symptoms. Also we will discuss its treatment and other important features. So in this part of the class, let's begin with tuberculosis. Now what is tuberculosis? Tuberculosis is a chronic communicable disease. It's a chronic communicable disease caused by Mycobacterium tuberculosis, which primarily affect lungs. Which primarily affects which part of the body, that is lungs. Mycobacterium tuberculosis are tubercle bacilli, also known as tubercle bacilli. Bacilli means bacteria, tubercle bacilli. A major health problem in developing countries. Nowadays, the vaccination, the treatment is totally developed. It is not that serious nowadays, but earlier in 70s, 60s, 80s, it was a very serious concern for the humanity, for the society. Okay? Now, moving on to types. The tuberculosis is divided into 4 major types. Okay? Pulmonary tuberculosis, avian tuberculosis. Okay, this avian tuberculosis mostly affect by birds. Okay? Then bovine tuberculosis, it affects cattle. This avian tuberculosis affects birds, and this bovine tuberculosis affects cattle, just like your cow, buffalo, etc., etc. And the last one, that is military tuberculosis, okay, which very rare, but it is indicated over here because there is some cases. Okay, so primarily सबसे important हमारे लिए जो होगा, that is your pulmonary tuberculosis, which affects the general society, general people. Now, let's talk something about this communicable agent, the causative agent, that is Mycobacterium tuberculosis. So this Mycobacterium tuberculosis, okay, is highly aerobic, and this is the reason why this aerobic means what? Aerobic means it needs oxygen for survival. This Mycobacterium needs oxygen for survival. And which part of your body mostly contains oxygen? Lungs. And that is why this particular Mycobacterium tuberculosis, which is aerobic in nature, is mostly affecting the lungs part of human being. It is gram-positive in nature, is non-motile, and mostly affect lungs. Okay? It is so powerful that it divides every 15 to 20 hours. हर 15-20 घंटों में ये इतना मल्टीप्लिकेशन हो सकता है. Unable to be digested by macrophages. This is important thing. We have an immune system. We have a innate immune system, right? Which is already located, which is already present in our body, a defense mechanism. And the macrophages are the part of that defense mechanism. But these macrophages are unable to digest it because they are totally incapable. Okay, they are totally ineffective, very resistant to many disinfectants like acid, alkali and drying. आप इसके ऊपर acid डालोगे, alkali डालोगे, strong acid भी डालोगे, it's totally resistant. Okay, कुछ नहीं होगा उसको. If not treated properly, TB can be fatal. Fatal means deadly. It can take your life. Okay. Now, if you go by, yes, we will go into that. If you go by the contamination process, I mean the mode of transmission, it is very contagious and spreads through inhalation of airborne bacteria from infected person. अगर कोई infected person है, okay, by sneezing, by coughing, okay, by touching, if the hands are infected with the sneezing and coughing, and if this infected hand touches healthy person, then this can transfer from one person to another person. Okay, because it is present in the lungs, then all the air, all the droplets which are coming out of your lungs, they contain this Mycobacterium tuberculosis. Understood? Yes. Now, let's dive deep into the history part over here. Just a moment. In 1882, Robert Koch discovered the staining technique for this TB bacteria. First time in 1882, the scientist name is Robert Koch, who discovered this technique way before in the history, and it was the first time. Mycobacterium is the bacteria that causes tuberculosis. Okay? Now, tuberculosis is one of the most prevalent infections of human beings and contributes to considerably illness and death. This death portion is not that prevalent, but infection is also there, but we can clear it, we can stop it by using different new vaccinations, different medications which are very effective nowadays. Okay? Now, let's move to the common sites of a body a TB microorganism can affect. TB grams are most commonly found in lungs. सबसे ज़्यादा एक पेशेंट के शरीर में अगर कहीं मिलेगा तो ये लंग्स में मिलेगा, ठीक है. लेकिन इसके अलावा in some cases it is also found in pleural, it is also found in central nervous system, liver and spleen, lymphatic system, genitourinary system, bones and joints, and disseminated miliary TB. Okay, disseminated means combinedly multiple organs को affect करेगा, not only single organ. Here single organs are affected, but if it happens combinedly to different organs at the same time, that is called disseminated TB. Okay, now if somebody asks you what is the difference between TB infection and TB disease, what will be your answer? TB infection and TB disease, both are different things, and here is the answer. TB infection is caused by same germs, that is Mycobacterium tuberculosis. Okay, and it is less serious. But whereas TB disease occurs when the TB germs are active in person's body for a large numbers. Okay, suppose 10, 20, 50 number of bacteria entered into a body, healthy body, and suddenly it is called TB infection. But when it rests there, when it multiplies there, okay, inside the body for a longer period, for a large number, अगर वो multiply हो जाते हैं तो वहाँ पे आपका TB disease शुरू हो जाएगा, जो कि TB infection से ज़्यादा risky है, ज़्यादा deadly है. It is more serious. The people with TB disease usually feel sick and have one or more symptoms of TB disease. इसी TB disease condition में जो पेशेंट है उसको सिम्टम्स शो करना चालू हो जाएंगे, लेकिन इन्फेक्शन में उतना सिम्टम्स शो करना चालू नहीं होंगे. सो वी कैन अंडरस्टैंड दैट टीबी इन्फेक्शन इज अर्ली स्टेज. जब पहले बार कोई इन्फेक्शन हुआ है इन अर्ली स्टेज, इट इज कॉल्ड टीबी इन्फेक्शन. बट आफ्टर सम टाइम इन लेटर स्टेज, when the multiplication of organism happens in the body, it becomes stronger, it becomes deadlier, then it is called TB disease. And the signs and symptoms starts to show in the TB disease phase. यहाँ पे आपको कोई symptoms TB infection में नहीं दिखाई देगा, लेकिन यहाँ पे disease में दिखाई देना चालू हो जाएगा. यही चीज़ को हमने यहाँ पे एक टेबुलर फॉर्म में दिया हुआ है. ये आपके वाइवा के लिए और आपके जनरल कंसर्न के लिए बहुत इंपॉर्टेंट हो सकता है. ठीक है, मूविंग ऑन. नाउ causative agents. As I have told you, Mycobacterium tuberculosis is the primary causative agent of TB, but there are other species also. Let's look into it. TB is an airborne disease caused by bacterium, that is Mycobacterium tuberculosis. Okay? Now, this Mycobacterium tuberculosis refers to a group. ये एक फैमिली है, ये एक ग्रुप है. ठीक है, उसमें बहुत सारे सब स्पीसीज आते हैं. फॉर एग्जाम्पल Mycobacterium bovis, मैंने बताया अभी, it affects cattle, Okay, Mycobacterium africanum, Mycobacterium microti, Mycobacterium capri, Mycobacterium pinnipedi, Mycobacterium caneti, and Mycobacterium mongi. Okay, these are different subspecies only. Among all this is the most important thing which affects and which is found in many cases of TB infections. That is Mycobacterium tuberculosis. Okay, as you can see over here, the diagram of this bacteria, a rough diagram of this bacteria. Now, moving on, the signs and the symptoms. Okay, the symptoms may vary depending upon what type of tuberculosis you contract. Okay, I had told you tuberculosis might affect your lungs, it might affect your intestine, your kidneys, your other parts of the body. So, depending upon the types of TB, depending upon the types of infections of TB, the signs and symptoms may vary a little bit. But the most common infections are here, and they are fever, chills, night sweats, loss of appetite, which is called anorexia, and weight loss and fatigue. Weight loss and fatigue. Obviously, chronic fever will be there, chills will be there. Chills means a sensation of severe cold. Okay, night sweats, loss of appetite, weight loss and fatigue. And one more thing, you should add coughing, cough with blood. This is most important and most common also. Chronic cough will be there, long cough will be there for a longer period of time, what I mean to say. And cough contains blood smear. The cough contains blood smear. Chest pain. It depends on the stage of infection. If the lungs is filled with fluid, infections बहुत देर तक हुआ है और वहाँ पे अगर फ्लूइड जमा हो गया है, पस जमा हो गया है, क्योंकि इन्फेक्शन होगा, सेल अगर डैमेज करेगा तो वहाँ पे पस जमेगा, इन्फ्लामेशन होगा, फ्लूइड जमा होगा, तो वो भी कुछ समय बाद इन्फेक्शन बढ़ता जाएगा तो जो सब बाहर आएंगे. Okay, so coughing, cough with blood, chest pain, very common. Weight loss is very common. Tiredness, fever, night sweats and chills and not feeling hungry, which means loss of appetite. Okay, now the mode of transmission, I told you earlier, the Mycobacterium tuberculosis is carried by airborne particles. Airborne particles means whatever the particles which are moving from one area to another area through the air medium. Right now I am talking to you, which means my whatever the airs which are being expelled by my mouth or my nose is being airborne in this air of the classroom or lab. Okay, so Mycobacterium tuberculosis is carried in airborne particles. Whatever the particles is being carried out by this air is called airborne particles, called droplet nuclei. Okay, droplet means what? Whenever somebody talks, whenever somebody does something with open mouth, okay, may it be speaking or may it be crying, may it be coughing, sneezing. Okay, if open mouth is there, then the saliva, then the fluids of the mouth will come out in a very small droplet form, very small particular form, and that is called droplet nuclei. And in that droplet nuclei, occurrence of what? Mycobacterium tuberculosis will be there. And of 1 and 5 micron, the diameter, the Mycobacterium tuberculosis is transmitted through air, not by surface contact. Air से बहुत ज़्यादा ये पास हो सकता है. By coughing, by sneezing, by speaking, by singing, laughing, whatever the process you do, you spread lots of droplets through mouth, out of the mouth, through the air. Okay? Is it clear? Now, evaluation for TB. How do you evaluate? How do you, identify? Okay, so here you can see there are many tests, many evaluation process which are being done, which have been done by the pharmacist, by the paramedical staffs, by the medical fraternity to evaluate TB. And here they are: HIV test, medical history, physical examination, bacteriologic and histologic exam, chest radiography, which is very important also. When you do an X-ray process, radiography process of the chest, you will clearly see the internal structure of the lungs. Okay. So it is again described. The most commonly used diagnostic for tuberculosis is skin test, blood test, sputum test. Skin test, a false positive test may happen if you have been vaccinated nearly with the bacilli. Blood test, the test uses sophisticated technology to measure the immune system. अगर आपको ब्लड टेस्ट किया जाएगा तो पता चलेगा कि बॉडी में इम्यून सिस्टम का क्या कंडीशन है, WBCs का क्या कंडीशन है. अगर इन्फेक्शन हुआ है तो वहाँ पे आपको डिक्टेशन मिलेगा that there is an infection. तो इसीलिए blood test, sputum test, which is very important. Your sputum, a patient who is TB positive, his or her sputum contains which bacteria? Mycobacterium tuberculosis. If you take that sputum and put it under the microscope, you will clearly identify the Mycobacterium tuberculosis. These are the tests. These are the tests. Okay? Then we are coming to the most important segment of this particular class, and that is your treatment. Okay? That is your treatment. So, as it is a communicable disease, okay, and communicable disease means it can be transmitted from one person to another through various medium. May it be air, may it be water, may it be touch, whatever the different mediums. But here in this case of TB, we have already studied that it is transferred through airborne medium, by coughing, by sneezing, by laughing, by speaking, through the sputum or through the droplets. Okay? Now, here the treatment of TB is very important, and it is a prolonged treatment. It's not like that you take 10 to 20 tablets for next 10 days or 1 month and the TB will be treated clearly. No, it is a prolonged treatment. Here आपको क्या करना पड़ेगा, आपको साल भर, 1.5 साल, 2 साल ये कंटिन्यू रखना पड़ेगा पूरा ट्रीटमेंट, तब जाकर के ये कंप्लीटली ठीक हो पाएगा. ओके, सो हियर यू कैन सी इट इज अ प्रोलॉन्ग ट्रीटमेंट एंड मे प्रोलॉन्ग इन्फेक्शियस. ओके, directly observed therapy to assure adherence, completion and recommended. Now, this is the overview. Let's go deeper in detail. Classification of anti-TB drugs. What are the drugs? It is based on chemical moiety. The classification is salicylic acid derivatives, pyridine derivatives, pyrazine derivatives, ethylene diaminobutanol derivatives and antibiotics. ये जो classification है यहाँ पे, ये किसके ऊपर है, कौन किसके बेसिस पे है? बेस्ड ऑन केमिकल मोइटी. बेस्ड ऑन केमिकल मोइटी. तो सैलिसिलिक एसिड डेरिवेटिव्स, द एग्जांपल इज para amino salicylic acid, that is PAS, para amino salicylic acid. Then pyridine derivatives, the examples are isonicotinic acid hydrazine and ethionamide. And the third one, that is pyrazine derivatives, the example is pyrazinamide. And ethylene diaminobutanol derivatives, the example is ethambutol. Ethylene diaminobutanol derivatives, example is ethambutol. And rest are the antibiotics, streptomycin, cycloserine, rifampicin, kanamycin, etc., etc. One by one, we will go deeper in the next slide. Now, earlier in this slide, we were actually discussing the classification on the basis of chemistry, on the basis of chemical moiety, according to their derivatives. Okay, but in the second classification, which is the more practical classification, here we have we have discussed the drug, the anti-TB drug, according to their use and their discovery. First line drugs, second line drugs. Okay, the whole anti-tubercular drug is classified into first line drugs and second line drugs. The first line drugs have high anti-tubercular efficacy as well as low toxicity. In pharmacology, we know it very clearly that if you have many drugs, then which one is the best drug? Which has high efficacy and low toxicity. So these first class or first line drugs have high efficacy and low toxicity, and the examples are rifampicin, isoniazid, pyrazinamide, ethambutol, and streptomycin. In short, there is a mnemonic you can add to remember this, and that is RIPES. R-I-P-E-S, RIPES. Rifampicin, isoniazid, pyrazinamide, ethambutol, and streptomycin. In the second hand, the second line drugs are either low anti-tubercular efficacy or high toxicity. That is why whenever you have a TB patient, always give first priority to this first line drugs. If it doesn't work, then go for the second line drugs. So what are the examples of second line drugs? Fluoroquinolones, amikacin, cyclosporin, ethionamide, para-aminosalicylic acid, and that is capromycin. And the mnemonic for second line drug is phase pack. Okay, F for fluoroquinolones, A for amikacin, C for cyclosporin, ethionamide, para-aminosalicylic acid, and capromycin. So this is the classification. Apart from that, some new drugs are there which are mostly antibiotics. What are these? Mostly antibiotics: ciprofloxacin, ofloxacin, clarithromycin, azithromycin, rifabutin. Okay, among all this, the most important and most useful is first line drugs. If somebody is developed with resistance, then you go for second line drugs. Okay, अगर किसी के शरीर में काम नहीं कर रहा है फर्स्ट लाइन, आप वहाँ पे सेकेंड लाइन ड्रग्स जा सकते हो. Is that clear? Now, we will take one example over here, and that is rifampicin. Okay, the drug of first line, rifampicin. The first line antibiotic drug rifampicin interferes with RNA transcription in Mycobacterium tuberculosis. Simple. How does it work? If you may ask me, sir, how does it work? What is the mechanism of rifampicin? Then I will answer simply, it interferes RNA transcription in Mycobacterium tuberculosis. You all know that DNA to mRNA, mRNA to protein. Every microorganism needs protein to survive. Yes or no? Without protein, it doesn't survive. Protein is the base, the building block of the cell of that bacteria. So the protein is synthesized by DNA to mRNA, mRNA to then again protein. This DNA to mRNA is called transcription, and mRNA to protein is called translation. This particular RNA transcription, that is DNA to mRNA process in the bacteria, is interfered by rifampicin. तो वहाँ पे अगर वो जो DNA टू mRNA यानी कि RNA ट्रांसक्रिप्शन में अगर इंटरफेरेंस होगा, अगर रिफाम्पिसिन उसको रोकेगा, उसको ब्लॉक करेगा, तो क्या ये प्रोटीन सिंथेसिस कर पाएगा? नहीं कर पाएगा. एंड देन अल्टीमेटली इट विल बी destroyed. Okay, so these are the things, and the most common side effects of rifampicin is hepatotoxic, respiratory breathlessness होगा, एब्डोमिनल में नोसिया, वोमिटिंग, एब्डोमिनल क्रैम्प्स होगा, फ्लू लाइक सिम्टम्स होंगे जैसे कि चिल्स, फीवर, हेडेक. ओके, एंड हेपेटाइटिस, लिवर फेलियर होगा. हेपेटाइटिस है, हेपेटोटॉक्सिक है, इसीलिए इसको देख करके एक सही डोज के साथ हम इस्तेमाल करेंगे, दैट इज 10 mg per kg. ओके, नॉट मोर देन 50 kg. ओके, आप देख सकते हो यहाँ पे. Am I clear? This is the picture. Now, moving on to multi-drug therapy. What do you mean by multi-drug therapy? MDT in short. When one single drug is not efficient, is not effective against the TB, then we will use multiple drugs, more than one drugs. And that kind of treatment is called multi-drug therapy. Here it is written clearly, multi-drug therapy to treat TB means taking several different anti-tubercular drugs at the same time. just like you are combining two or more drugs same time. So drugs are combined to delay the development of resistance. Usually what happens, single drugs can, the body can develop, the mycobacterium can develop resistance. वो उसके अगेंस्ट माइकोबैक्टीरियम जो है उस ड्रग के अगेंस्ट रेजिस्टेंस डेवलप करेगा और ड्रग का कोई भी इफेक्ट बचेगा नहीं शरीर में, उसका कोई वैल्यू ही बचेगा नहीं, उसका कोई बेनिफिट नहीं बचेगा. तो इसीलिए हम क्या करते हैं, उस रेजिस्टेंस को रोकने के लिए मल्टी ड्रग थेरेपी दे सकते हैं, टॉक्सिसिटी को रिड्यूस करने के लिए दे सकते हैं. ओके, शॉर्टन द कोर्स ऑफ ट्रीटमेंट. मतलब अगर सिंगल ड्रग अगर 2 साल चल रहा था तो हम मल्टी ड्रग दे करके उसको बहुत जल्दी भी ठीक कर सकते हैं, शॉर्ट कर सकते हैं. जो कोर्स है, जो ट्रीटमेंट का टाइम है, उसको हम छोटा कम समय में ख़त्म कर सकते हैं. ओके, नाउ ये सब हम समझ चुके हैं, डेवलप हो रहा है रेजिस्टेंस. ठीक है. नाउ कॉमनली यूज्ड combined drugs, the drugs which are most commonly used are called rifampicin, isoniazid, pyrazinamide, ethambutol. The short is RIPE. Okay, combinedly used, multi-drug used. Okay, 2 phases of drug therapy are generally used. One is initial phase and second is continuous phase. In initial phase, okay, 3 drug is given: rifampicin, isoniazid, pyrazinamide. Okay, sometimes ethambutol also used. Okay, and in these drugs it is taken for 2 months. Okay, these drugs used for 2 months. After that, 2 extra drugs is also substituted, that is rifampicin and isoniazid are to be used for time period next 4 months. 2 महीने बाद अगले 4 महीने के लिए आपको 2 एक्स्ट्रा ड्रग आपको वहाँ पे सब्स्टिट्यूट करना है. पहले वाले को सब्स्टिट्यूट कर देगा सेकेंड. तो इनिशियल फेज में आपका 3 या 4 ड्रग चलेंगे और कंटिन्यूस फेज में आपका 2 ड्रग चलेंगे. इनिशियल फेज 2 महीने के लिए चलेंगे और कंटिन्यूस फेज 2 महीने के बाद अगले 4 महीने के लिए चलेंगे. समझ आ रहा है आपको? ओके. That's it. So these things are most important for your TB chemotherapy. Okay, the questions may arise: what is TB? What are the causative agents? What are the modes of transmission? And write directly about the treatment of TB. In the treatment of TB, you have to write the classifications, you have to write the examples, and then you have to write the side effects, their use, etc., etc. Okay. This is all about. I will put this note into your group. Okay. अगर होगा तो हम इसको PDF में डालेंगे या फिर होगा तो हम इसको एक YouTube वीडियो के हिसाब से भी डाल देंगे. ठीक है, आपको लिंक मिल जाएगा ग्रुप में. ठीक है, कहीं पे कुछ पूछना है पूछ सकते हो. इट्स ऑल ओवर हियर. एंड दिस चैप्टर बिलोंग्स टू द फर्स्ट point of your unit 3. You can check it. Okay.